McCall is really the best of all worlds. We wake up every day and pinch ourselves that we get to live here. The wonderful people that live in such a close-knit community.
We all really take care of each other. It's very common in a small community that your patients are your neighbors and your neighbors are your patients. We all desire someone who can really look out for us and shepherd us. I feel really positive that we're able to offer that here in McCall.
One of the beauties of living in McCall, it is such a great community. Everybody helps. I've had probably way too many experiences having to be in the ER, but grateful for every moment because I had the best care, and I so appreciated that. Trust me, that's why I'm here. I'm excited to know that we're looking at expanding the facilities up here in McCall. Having a chance for our hospital to grow is really amazing and actually very needed.
Oldest part of the hospital now is over 60 years old. A lot of the old facility really doesn't lend itself to remodeling at this point in time. We really need to be replacing some of the oldest part of the facility.
We are working with a facility that was built in 1956. Well, there's been renovations or upgrades to it. The basic infrastructure is still 60 years old.
The whole point is to build a hospital that is going to be as modern as we can predict. It can't be just upgraded. We have to actually start from scratch and build anew. The goal is to keep people as active as possible, to play harder longer.
We desperately need more room. This is not our busy season, and yet we're busier and busier. We have the staff and the ability, but if we can't get them back to a private room where we can talk to them, then we really can't start providing that care in a timely manner.
We've seen really significant increases in the number of patients served. I think that trend will continue.
Having the quality of care that's offered here is so important. Patients come from all over to have surgery here and care.
By updating the facility like we're going to do, we're certainly going to continue bringing the caliber of doctors and nurses and auxiliary staff to this hospital. And I think that's what we're trying to do here is maintain this amazing staff we have. I am so lucky to have the partners I do.
Good doctors want to be working with the best equipment so that they can achieve the best patient outcomes. That's what it's all about, patient outcomes.
You're able to encourage others to come enjoy an area when they know there's a sustainable healthcare system behind them, and it brings the whole caliber, I think, of the community up.
Very, very fortunate to have a hospital of our quality in a town this size.
We get to see a lot of people, with knee injuries and stuff like that are buying gear for the next season or whatever, and they plan when they have these, surgeries around when they're going to play. And being able to do that here and rehab here is incredibly important.
I do feel like our community pulls together to do what it needs to do, and it makes a difference between being able to do the bare minimum and being able to go the extra mile.
There's no question that people want to retire here because of the health care that's available. We need the entire community to get behind this. There's no more compelling cause going on or likely to go on in McCall, period.